Hello, my name is Tomotaka Saito. I am in Department of Gastroenterology, the University of Tokyo, Japan. I'm co-principal investigator of the Wonderful Study Group. Wonderful standing for wound and peripancreatic fluid collection. I'd like to present our study published recently in GI endoscopy, entitled Inverse Association of Hospital Volume with In-Hospital Mortality Rate of Patients Receiving Endoscopic Ultrasound-Guided Interventions for Pancreatic Fluid Collections. I'm especially grateful to Dr. Nakai and Dr. Hamada. Both played an essential role in this study. As you know, endoscopic treatment of ward of necrosis and shootosis is one of the most challenging procedures. As the Wonderful Study Group, we have tried to provide evidence for better clinical outcomes. In this study, we examined hospital case volume as a potential prognostic factor, which was defined as the average annual number of patients treated at a given hospital. Past studies found a relationship between high hospital volume and improved outcomes in various acute GI diseases, like acute pancreatitis. However, we had only limited data on hospital volume for our disease. If we found a volumes outcome relationship, we could improve patients' outcomes through transfer. Using a nationwide inpatient database, including more than 4,000 patients up to 500 hospitals, we examined the hospital volume in endoscopic treatment of pancreatic fluid collections. We found higher hospital volume was associated with lower risk of all adverse outcomes examined, including in-hospital mortality, bleeding, long hospitalizations, and high costs. We observed those associations regardless of stent types, that is, lumina-posing metal stents versus plastic stents. I'd like to conclude patients with pancreatic fluid collections may more likely be saved at high-volume centers. For the next step, we should clarify which cases should be transferred to high-volume centers. For example, we find patient or disease parameters associated with adverse events related to the treatment. Non-specialized endoscopists may want to transfer patients with those parameters for the treatment. Therefore, the Wonderful Study Group will conduct research on risk factors for adverse outcomes to identify high-risk patients for referral. In addition, we need to define a cutoff number for high volume versus low hospital volume to propose recommendations for clinical practice guidelines. Finally, I would like to appreciate the members of the Wonderful Study Groups and collaborators from the Nationwide Database Research Group. Thank you so much.